Philene is a physiotherapist that I work with a fair bit, and I work with many different physiotherapists, and I find that while all physiotherapists are very well trained, there are some physiotherapists who particularly can work with people who are athletes, and quite a number of patients that I see are pretty physically active. Even before their cancer diagnosis. And one of the things that they find most difficult to get back to is to being an athlete. They run, they cycle, they want to get back into competition, but they just find it rather difficult. So I work with Philene a fair bit. She's the principal physiotherapist at Movement Mechanics Physiotherapy. They work with all patients post-stroke, post-treatment, but they also work with athletes. Specifically, they help people who like to run very fast to walk properly first and then to run properly. Without further ado, I'm going to hand over. Philene, it's all yours.
Hello, hi everyone. So yes, lower back pain is one of the common injuries that we see at the clinic, and it is very important even for people without cancer to learn the correct technique in protecting their lower back, as our disc in our spine would have been degenerating since we reach our adulthood. So next slide, please. So there are some lumbar support that are on the market. There are those that are gel. So sorry. So there are those that are made of gel. Then there are those that are having memory foam in there as well, and as well as something that is very common called the back joy. So just give me a second. I can't see the slides. Okay, can you guys see the slides? Oh, I'm so sorry. Hang on a second. Just get the slides up. Okay, sorry. All right. So maybe while waiting for the slides, we can do something easy. So I'm assuming that all of you are seated. Make sure that you place your both feet on the floor comfortably. You can try sitting off the, have your back away from the backrest, and you try slouching. Yeah, you can. And then you can try sitting up tall. So that is one of the important movements of the lower hip and your lower back, the pelvis movement and the lower back. Okay, I'll talk more about it later. So let's get back to the slide. So these are the more common lumbar support that is available on the internet, like Amazon, Lazada. And the most important thing to take note is that how comfortable you are using these. It might sound like a waste of money, but if you have friends or relatives that has it, try it. There are some of them which are pretty inexpensive. Yeah, you can actually try and see whether it fits your lower back curve. Everyone's spine curves differently. So the comfort that you have, like fitted, whether you can lean back and are you close to the chair, the backrest, or does it still have a gap? Is it pressing too much against your spine? Those are very important, and it needs to feel comfortable. If you still have back pain, even using those lumbar support, then you're not benefiting from it. The first one, for the memory foam, there is a base, the memory foam that is added onto the chair. Sometimes that may not be necessary. because if you have a good chair that has a support there, you actually don't really need that. Except for, I think some of my patients who have maybe their glutes muscles, your bum muscles are not that like, you have a flat bum, you're bony there, your tailbone, you find that your tailbone presses on the chair seat, then you might find that another gel foam to sit on is much more comfortable. I haven't tried the back joy, but it's mimicking how you sit on a gym ball to actually try and increase and get you to curve your spine a bit more. But that said, if you have you are pretty sedentary, your core muscles may not be that strong, you might feel fatigue quite fast, and you may not get any benefit from the back joy. Okay, so this picture is very interesting. A lot of the time, before the standing desk came in, a lot of people say, oh yeah, let's buy a gym ball to sit on to correct your posture. But actually, any type of support or different chairs, you will be able to slouch in the second picture. So the thing about it is the moderation, whether or not how many hours you're seated. Get up and walk, or even do some pelvic tilts on sitting, so that you will actually offload the pressure in your disc, and then you can actually lessen the ache in your lower back. All right. Yes. So the most inexpensive method is to actually roll up a beach towel and put it at the small of your back. This, some people may be able to have their upper back still in contact with the backrest. Some don't, but you need to experience how thick the beach towel end up as. Yeah, so you need to be, you can adjust it. It should be nicely supported at the curve of your lower back. Yeah. So the trick is to actually get that 90-90 kind of posture. You need to actually build some awareness whether or not you are slouched really close to the screen, whether you are leaning too far to recline, and all those little bits of posture habits will add up into like a 7-hour kind of desk-bound job. Yeah, so that is very important to take note of. Besides exercising, which actually will strengthen up the postural muscles of your lower back, we'll be going through the exercises later so that you can kickstart some basic exercises that will help your back pain. All right. Okay, so this is my colleague. Oh, Huiti, want to introduce Alicia? Okay, so this is my colleague, Alicia. She sends her sincere apologies that she can't join in today, but she's one of our rehab trainers who is really good at correcting movements and actually strengthening most of our clients that has come out of injury. When it got them pain-free, we'll send them to her to get more strength, coordination, getting higher level functioning of training and getting back to sports. So she has a personal trainer background, and now she's very interested in rehabilitative training. So she's very patient, and but like, she's quite tough. Like she will actually push you to your limit. Yeah.